Here at UCSF Health, providing exceptional care means ensuring every patient feels heard, respected, and understood. Working effectively with qualified medical interpreters is essential to achieving safe, inclusive, and equitable care. In this video, we will demonstrate the best practices for partnering with interpreters, navigating common challenges, and supporting meaningful communication with our diverse patient population. Thank you for all you do to create a respectful, inclusive, and welcoming environment for our patients.
Sometimes a family member or friend may want to act as the interpreter. While this may seem like a convenient option, it's always best to work with a qualified medical interpreter when communicating health information. This also ensures we adhere to the laws and policies protecting patient rights.
I know it's really important for you to support your mom. And I think that the best way to do that is for us to work with a medical interpreter to communicate during this visit.
I've interpreted for Mom before. I mean, I know her medical history really well. Why can't I help this time?
And I know that you do. I know that you know it front and back, and you have been an amazing resource to your mom. And she is so lucky to have you, and I know that you know her medical history, and I know that you are a native Spanish speaker, and you are very fluent. I also know that medical interpreters are trained in medicinal Spanish. And even though I know that you are very fluent, those translations and those medical terms can be really difficult to make, even for a native Spanish speaker. So I really recommend that we work with a medical interpreter. That way, during the visit, you can make sure that you're able to listen, make sure that we don't miss anything important, that you can also take notes if you want.
Oh, okay. No, that makes sense. I hadn't considered that. Thank you for explaining.
Of course. That's probably the interpreter.
Ma, vamos a trabajar con un interpreter.
Come in.
Hi, Dr. Perez.
Hi.
Hola. May I introduce myself to the family?
Please.
Hola, mi nombre es José Luis y seré su intérprete de español el día de hoy. Todo lo que se diga se mantendrá confidencial y debo interpretar exactamente lo que usted diga. Por favor, hable en oraciones cortas y haga pausas para que yo pueda interpretar. Dr. Perez, I'll be your Spanish interpreter for today. Everything you say will be kept confidential. I have to interpret exactly what you say. Please speak in short sentences and make pauses so I can interpret.
Great, thank you. Let's get started. Mrs. Diaz, tell me what brings you in today.
Genial. Vamos a empezar. Entonces, señora Díaz, ¿me puede decir?
Notice the interpreters ask the patient and the clinician to speak in short sentences and ask for pauses. Though all interpreters approved to interpret at UCSF are qualified, skills can be variable. While some can retain as many as 5 ideas, many retain up to 3 ideas. Please be considerate of this variability when working with interpreters. Sometimes family members may hesitate to work with an interpreter because they don't want the patient to learn certain medical information. In this scenario, the clinician listens to the family's concerns before the interpreter arrives.
I don't want to tell my dad about his diagnosis. I don't know how he would take it. Can you not tell him, but still explain the treatment?
So first, I want you to know that you're not alone at all in feeling this way. Many families ask for this. One of the things that's required for us is to engage with your dad about what he wants to know, for him to be able to set his own limits. And I respect that you don't want to share that much, and we don't absolutely have to, but I do need to ask him for his permission about what he wants to know, and I'd like to involve the interpreter to be able to do that. How does that sound?
Okay.
Okay, thank you. Come in.
Hello, doctor.
Hi.
May I introduce myself to the patient?
Absolutely, this is the patient.
Oh, hello, xin chào你好, 我係姓羅, 負責你個今日個廣東話翻譯員. 你所講的每一句我都會準確幫你翻譯，同時為你保密。
好啊，唔該。
Although the patient has a right to decline the services of a qualified medical interpreter, the clinician also has a right to retain one to ensure the communication with the patient is accurate. Staff and clinicians should make every effort to encourage working with a qualified medical interpreter. However, if the patient continues to decline, it should be documented in the patient chart. It is UCSF Health's responsibility to provide complete and accurate communication. Just because a patient declines the interpreter during one visit, it doesn't mean that decision is permanent. Please offer interpreting services for each visit unless the patient decides to change their preferred language to English.
Ms. Garcia, it's so nice to meet you. My name is Dr. Shah. I'm one of the lung doctors at UCSF.
Hola, señora García. Yo soy la doctora Shah. Un placer. Soy una de las pulmonólogas.
No. I don't need interpreter. I got this. I hear you, but sometimes medical conversations can get complicated and important things can be missed. I have found that it's really helpful to have an interpreter here just to make sure that both of us are really understanding each other. How does it sound if we keep the interpreter in the room with us, and if either of us decide that we need her, she can jump in?
Yes, okay with me.
Great, thank you so much. That just really reassures me that my communication is really clear and that I'm able to answer all of your questions.
Yes, I'm good.
Okay, great. What's on your list to talk about today during this visit?
How about my condition?
Yes, I noticed that you said that you were feeling short of breath.
During an in-person visit, a family member may want to have a conversation with the clinician in English, which could leave the patient with limited English proficiency out of the loop of their own health care. In this type of dynamic, an in-person interpreter is recommended because the interpreter can simultaneously interpret for the patient while the clinician and family carry on their conversation in English. If the patient has a question, the interpreter can pause the conversation to insert the patient's question.
Are you still taking the 10 milligrams of lisinopril?
¿Sigue tomando los 10 miligramos de lisinopril?
This is taking so long. Why can't I just talk directly to you? I mean, I feel like we're repeating everything twice.
No, I apologize that it feels like it's taking a little bit longer than normal. That's not our intention. Our goal here is to provide the best care to your mother, and we need to capture the most accurate information, and the interpreter is helping us to do so.
I know, and I want everything to go smoothly, but doesn't take up so much time.
No, I hear you, and we want to be respectful of your time and your mother's time as well, too. Again, our intention here is really to make sure we provide the best care to your mother, and the interpreter is going to help us translate that information so we can do so.
So speaking as the interpreter, I can interpret simultaneously to help move things along, and that way you can keep talking directly to Dr. Day.
Okay, yeah, that works for me, yeah.
Is it okay if we continue?
Yes.
Está bien, continúa.
So your mom is taking the 10 milligrams of lisinopril?
Yes, she is. She takes them once a day in the morning.
As a bilingual clinician or staff member, you may be asked to interpret. While your language skills are valuable, it's important to understand the boundaries of your role. Medical interpretation requires specific training and expertise.
Excuse me?
Yes.
I heard you're a certified bilingual staff in Mandarin. Do you think you could help interpret for us so we don't have to call an interpreter?
I do understand your urgency. I am certified to speak directly with patients, but medical interpreting is a specialized skill set. How about we do this? I'll go pull in the qualified interpreter on video for you so you can work with them to speak to the patient clearly and accurately.
That makes sense. I appreciate you explaining that. Thanks for having us do it the right way.
Of course, let me go get the card.
Hi, my name is Rachel. I'm your Mandarin interpreter. How can I help you today?
Hi, I'm Dr. Kadakia. I was wondering if you could assist me with a Mandarin-speaking patient?
Yeah, of course.
Okay, she's already in the room now. I can introduce her to you.
Great, thank you.
Okay.
At UCSF Health, you can become a certified bilingual clinician or staff member to communicate directly with the patient. But your role does not extend to interpreting for others in clinical settings. This ensures that the communication remains accurate, clear, and impartial. Additionally, did you notice that the bilingual staff said to work with an interpreter and not use an interpreter? Please know that medical interpreters are professionals who are a part of the patient's care team. By following these best practices, you'll help ensure that patients have the clear, effective communication they deserve. It's not just about providing care, it's about providing care that is accessible and inclusive for every patient. Thank you for your commitment to making UCSF Health a welcoming and supporting environment for all.